I increasingly see more and more men are seeking rejuvenation for a variety of things. They're feeling more comfortable discussing body contouring procedures because even though there's been a lot of focus on the dad bod being the latest sexy appearance for most males, many males don't really feel comfortable about the excess adipose tissue on their trunk, and so they've been searching non-surgical options for reduction of that adipose tissue, including cool sculpting. They're now seeking options for liposuction because it can be done in limited fashion with very little downtime, and it certainly is more effective at reducing trunkal adipose tissue than 1,000 sit-ups a day, which is totally ineffective anyway. High intensity, short interval activities is more effective at reducing trunkal adiposity. Males are also seeking filler and neuromodulators like Botox because they want to appear fresh and youthful because they're competing in the work environment with a younger male these days, and men are working longer, and that's just the nature of things, so they want to appear more youthful. And it's becoming less of a stigma, and so people can freely search for what makes them feel more comfortable in their own skin. It's becoming increasingly popular to have facelifting procedures because as we've learned how to hide the incisions better in the male, we can reposition the facial skin, and the facial hair doesn't look like it's an abnormal position anymore either. And so this is very common. Common things that are also investigated are hair restoration. Male pattern baldness is becoming a choice these days. Now, some individuals shave their entire head as one option, which is reasonable and perfect for those individuals, but others want to consider follicular or single or 2 or 3 hair follicle transfer to try to bring more youthful appearance to their scalp with hair in a more anterior or central position. There are other things that can facilitate this to maintain the functional hair follicles that they have, including PRP injections that are done every 4 to 8 weeks in the scalp and subcutaneous tissue, which can stimulate the hair follicles that are still there and functional to grow hair. Things like the red light and helmet can also engage those follicles and help them to grow so that the scalp hair looks more full. These kinds of things will also work in appropriate individuals on the facial hair for those that want to have a full beard now. In the male, the brow tends to drop and become more ptotic in a more accelerated rate than the female. It's already lower in most individuals than the average woman. So when it begins to droop, in addition to the excess upper eyelid skin, it can accentuate the appearance of the tired or aged upper eyelid. And so eyelid surgery is very popular in the male population these days because essentially it's a simple operation. There's almost no downtime, and it's very difficult to see that the surgery has been done. So it's very popular in this subgroup.